So, Robert, thank you so much for willing to have this conversation. So, how would you describe the process experiential emotion-focused therapy main distinctive features?
Well, there are a set of characteristics, I think, that set process experiential emotion-focused therapy apart. It's no one feature, I think it's the combination of those things. First of all, this is a neo-humanistic therapy. It's a therapy based on humanistic principles that have been sort of reformulated and renewed on the basis of contemporary emotion theory and thinking about attachment and things like that. So it's neo-humanistic. It's also process-oriented. The original name of the therapy was process experiential because we wanted to capture the sort of intense look at the therapeutic process and the differentiation of the therapeutic process into tasks and responses and modes of engagement and all the different elements. So there's quite a high degree of process differentiation in the therapy. So it is very process-oriented. And it's also, of course, emotion-focused. You do see emotion as this sort of crux of the change process for clients, and also as the sort of core of what it means to be human. So it's emotion-focused. There's a particular exploratory response style that the therapist provides in the relationship with the client that's kind of a delicate kind of feeling your way into what's not quite clear, that's on the edge of what the client's been able to say, and that exploratory, but at the same time empathic response style, which is not non-directive, but it's also not directing the content, it's sort of guiding the client to a deeper process. I think that's fairly distinctive.
You are following and you are leading?
We're both following at the same time. It's really a kind of mutual process. And the therapy is also evidence-based. So it's built on a program of research, first into particular therapeutic tasks, which is how clients resolve certain issues that they bring into therapy, and then outcome research, and more recently randomized clinical trials and things like that. So we have these things, and they kind of come together in a package in process experiential emotion-focused therapy, which I think we believe is distinctive.
Okay, how is EFT distinct from other approaches and models of therapy?
Right, I think what I'm saying is it's actually that combination of things. I mean, there are other emotion-focused therapies, and there are other evidence-based therapies, and there are other humanistic therapies, and there are other process-oriented therapies, right? But somehow to bring all those things together,
that's what makes it.
I think that's what makes it distinctive. Right? Yeah. So we're not claiming we're totally unique in any one particular feature, but it's the package.
Okay.
Okay.
Can we identify clear phases or stages in EFT?
Well, I think that therapy in general has 3 stages, and that includes EFT. I think there's an opening and relationship building stage of the therapy. There's a main working phase in which there's deep exploration and restructuring that happens, and then there's a closing phase where we help the client to consolidate their gains and sort of aim themselves out of the therapy and beyond the therapy.
Okay, so those 3 main.
Yeah, that's true whether it's psychodynamic, cognitive behavioral,
yes,
EFT, right.
Okay. Yeah. Empathy appears as a core feature and skill in your model. Do you see empathy as a core construct in EFT or just a means to achieve a goal?
It is a core concept and a core process. The whole therapy is based on empathy. You can't do EFT effectively without this solid foundation of empathy, both in terms of the immediate therapeutic process, but of course also the skill of the therapist. This therapist needs to be highly skilled in empathy, and I think that things like chair processes, 2-chair work, empty chair work, actually place greater demands on the therapist's empathy than other kinds of therapeutic work. So empathy is absolutely foundational. I think the therapy is potentially dangerous without that solid foundation of empathy. And at the same time, and we do see empathy as having 2 different roles to play in the change process. First, empathy is a core change process too. So the process of being known, the empathic process is healing to clients, and takes clients a long way in their journey, even without the tasks. And secondly, empathy is the foundation for doing things like chair work or focusing. All of them need to be based on empathy. So empathy is both a means to an end and an end in itself in the therapy.
Okay. Do you think it's healing in itself?
I do think empathy is healing in itself, right? Yeah. And if you look at the research literature, person-centered therapy actually holds up pretty well in terms of the outcome literature. EFT looks to me like it's a little bit better. The comparative studies, the effect sizes, looks like it does a bit better, but person-centered therapy does quite well also.
Person-centered.
Yeah, person-centered therapy. And so I think empathy does get you a long way. And without it, you can't have effective EFT.
Okay. Depending on each client's process, it looks as tasks can take less than half the time of EFT process takes. If this is really the case, what is going on during the remaining 3
What do we do the rest of the time? We're not doing chair work. Well, first of all, you can't do chair work until somewhere around session 4, because the client has to have internalized you as an empathic presence strongly enough to be able to take their eyes off of you to look at the other chair, right? So before that, they're too busy worrying about, right? So there's this beginning phase of the therapy, which is the relationship building phase, and alliance formation, where you're not doing chair tasks, and then you can't do a chair task all every session. It's very intense. It needs to be worked into. It needs to be processed afterwards. And sometimes you stop in the middle and do something else and come back to the chair task. So even in a session that's mostly chair work, or unfolding, or one of the other main active tasks, even in those sessions, at least half of it is not chair work, right? So and then you can't sort of bang on with chair work every single session. The client needs a breather. There's different kinds of work that can be done using other kinds of, say, basically straight empathic exploration. And so the mix of the straight empathic exploration and different kinds of tasks, I think, is more effective than simply trying to, and of course the clients don't present the markers in every session. So we're not going to do chair work unless there's a marker for it.
So you find that isn't there an excessive focus on tasks in AFT?
Yeah, so our books, especially the first book, the 1993 book, Facilitating Emotional Change, that's Greenberg, Rice, and Elliott. That book was criticized, and I think rightly, for the lack of emphasis on the relational conditions, on empathy, and an almost exclusive focus on the chair task, focusing, systematic evocative unfolding. And people like Germain Littard and others took us to task for just the very thing of excessively focusing on those tasks. Now, we tried to redress that in the Learning Emotion Focused Therapy book, the 2004 book. So we put the relational work up front. We have extensive coverage of empathy and also relationship building processes, and they come before the active tasks. I think we get a better balance there. In the 2004 book. But of course the chair work is, it's sexy and exciting, and it's what people always, want to see and want to talk about. It's flashy. Right?
So EFT is also marker guided, you said?
It's marker guided, right. Yeah, that was the other distinctive feature that I forgot to mention, right. Yes, it's marker guided, right. Yeah.
Do EFT clients have homework assignments between sessions? And if they do, of what kind?
Well,
with which purpose?
Yeah, the most common form of homework we give, in fact the only kind of homework I give as a therapist, is what we call awareness homework, which is, can you pay attention to some process that we've been working on in the session? So if the client was working with their critic, I might say, see if you can be aware of when your critic comes up and what happens during the week, right? One of my clients is struggling with, one of my clients with social anxiety is working on her sense of ugliness. Right? So many clients with social anxiety have this feeling that they're ugly. It's not just a belief in their head, but it's a sort of deep embodied feeling that they're ugly. And so this just came up towards the end of the session. I said, we talked about it. I said, this sounds like it might be pretty important for us to work on. But during the week, well, maybe pay attention to times when you feel ugly, and also what you're doing to make yourself feel ugly. So that's awareness homework, and that's going to set up for us to do some more focused work in the therapy next time, probably, on this her ugly making critic process. Right, yeah, and that sort of thing. Or, you know, it might be if the client, we might say, pay attention to times during the week when you're find yourself feeling really anxious. And then we'll bring those in, and we can work with those and kind of unpack them and unfold them. So that's the kind of homework we give. Is that okay?
Yeah. We have seen a lot of effort to create manualized treatments, above all empirically supported.
Yeah.
How do you see these trends?
Well, you know, I mean, a manual is a funny thing, right? I mean, you can write a 10-page description of the therapy and call it a manual, and people do that. Right, okay, so you can write a little tiny thing and call it a manual, right? Or you can write a 300-page book, like the Learning Emotion Focus Therapy book is a manual also.
A complex one.
It's a complex one. Bill Stiles, in his review of it, said this is the most detailed therapy manual that's ever been written, because we try to get down to the nitty-gritty of the therapeutic process in a very specific way, and all these different processes. So there's that, you know, that's kind of that's on one end of it. And then you've got a whole bunch of gradations in between of more or less detailed manuals. So then, I mean, in a way, it's kind of a marketing thing. You know? Yeah, so
they result useful in a lot of ways for learning, for teaching, for training.
That's right, and training
For selling.
For selling the therapy, for getting grants. And students like them too, because they make them feel more comfortable or safe, right? So the manuals have their uses. The important thing about a manual is a good manual describes the therapist's responsiveness. So all therapies have to respond to their clients in a differentiated way. They can't just say, you know, plug everyone through the same process. All manuals have to do that. The good ones
have to be complex.
That's right. They have to build that complexity in, that responsiveness in. Right? If they don't do that, then it's basically not a good manual. Right.
And what about the therapist's creativity in these treatment manuals?
Well, I think there's room for creativity within a manual. You know, for example, I mean, you think about different kinds of art, you know, different, you know, or literature, or, you know, I mean, creative artists work within structures, right? They sometimes break through them, but there's something about structure which is a kind of bed for creativity. And I think manuals are like that too. You know, the manual provides the structure, and the therapist can be creative within that. And the highest level of mastery of a therapy, EFT included, is to be able to create new structures, new tasks. Right? You know, I think you haven't really mastered EFT or some of the therapy until you actually can begin to create new tasks.
Can we turn to the influences on EFT?
Sure.